Whenever an incident occurs in which someone is injured or suddenly taken ill, always remain calm and assess the situation. Approach with caution. Do not rush in because in doing so you may overlook a hazard to yourself. Always take 10 seconds to follow these procedures of assessment. First, initial evaluation. As you approach the area, look about carefully for unsafe conditions that may require immediate attention. The first 2 seconds belong to you. Assess personal danger. If the scene is unsafe, do not enter, but call for professional help at once. Consider the cause of the problem. Is the injured person in danger of additional injury if not moved immediately? Second, call out for help. There may be another person nearby who can phone the EMS and or get an AED and first aid kit. Before providing first aid treatment, identify yourself as a trained first aider and ask the patient for permission before doing so. If he is unconscious or an unaccompanied minor, consent is implied for life-saving care. Third, be alert for possible neck or back injuries. Special care is required at all times during the evaluation process if there is a reason to suspect that the patient has suffered a head, neck, or back injury. Maintain the body in the same position as found until the arrival of the EMS. Do not move the patient unless there is immediate danger of further injury or if it is necessary to provide emergency life-saving measures. Remember, it is not necessary for the patient to be lying down to check for normal breathing. If you must leave the injured patient alone in order to summon help, place him in the modified Haynes recovery position. Fourth, who needs help first? When there are several people who have been injured, the first aider must determine who is most urgently in need of care. Use the priorities of proper care as your guide. This decision-making process of quickly checking all of the injured and establishing an order of care is called triage. Fifth, your primary survey immediately follows the scene survey. It consists of a rapid evaluation of an individual's responsiveness and breathing. If you believe that trauma has caused breathing to stop, call out for help and begin CPR with 30 chest compressions followed by 2 ventilations. Perform CPR for 5 cycles, about 2 minutes, before leaving to call 911. Also included in the primary survey is a check for and control of serious bleeding. Sixth, determine the patient's problem. After providing first aid for life-threatening injuries and the patient is breathing normally, continue to observe the patient. While waiting for the arrival of the EMS, conduct the secondary survey. Determine if the patient has any other injuries or problems that need attention. Check for bleeding and fractures. If the patient is able to speak, ask the nature of the problem and or the cause of the injury. Examine the parts of the body for which the patient has specific complaints. Seventh, notify the EMS. Phone fast. If you establish unresponsiveness in any of the injured parties and or your assessment determines the need, initiate contact with the Emergency Medical Services System, EMS. Phone fast. In most areas of the country, this means a call to 911. In some outlying areas, this may not be the case. You must become familiar with the system used in your particular area.
Larry, Mike's down. Oh my God. Dan, call 911. Get the AED and the first aid kit. Hurry up.
If the mechanism of injury is such that spinal injuries are suspected, moving of the injured person is best done by the EMS. However, it may be difficult to determine if a prone, unresponsive person has an open airway and adequate breathing. In this case, life-saving care is an immediate need. In doing so, care must be taken to prevent additional injury.
Mike! Mike! He's not breathing. We're going to have to roll him over.
Okay, Larry.
The person is rolled opposite the way he is facing. Anticipating this, the person directing the rescue kneels where the patient will be positioned after the log roll. He then grasps the sides of the patient's face with a cross arm motion. One rescuer kneels at the feet to make sure that the legs move with the torso. Two more rescuers station themselves in position to pull the patient towards them. Note that their arms are crossed to equalize the force of the pull and to prevent spinal twisting. Only these two supply the power for the log roll. The two at either end are simply there to provide spinal stabilization.
Okay, we're going to have to roll him onto his side on the count of 3. 1, 2, 3. Easy. Keep his back straight. Roll. Back straight. Now we're going to have to roll him onto his back on the count of 3. Move back. 1, 2, 3. Keep his back straight.
If the properly positioned patient is not breathing normally, begin CPR with 30 chest compressions followed by 2 ventilations.
He's still not breathing. I'm going to start CPR.
If the single rescuer must move a patient, the shoulder drag or blanket drag are effective ways to do so. Here's a demonstration of the blanket drag. Lay the blanket lengthwise beside the patient. Fold it over several times. Pull the patient toward you and place him on his side. Rest him against your thighs. Tuck the folded blanket under the patient so that when you roll him back over, the blanket will be accessible. Place him on his back. Reach under and pull the folded blanket out. Now the blanket is on both sides of the patient. Roll the ends in, grasp them, and with a bent knee motion, pull the patient along the long axis of the body. Take special care to avoid twisting the neck or back. If there is a second rescuer present and there is no reason to suspect the patient has neck or back trauma, the fore and aft carry may be used if there is no stretcher available. The first rescuer supports the patient in a sitting position, reaches under the patient's armpit, and firmly takes hold of his wrists. The second rescuer will spread the legs, bend the knees, turn, kneel, and take hold of the patient behind the knees. On the count of 3, given by the rescuer closest to the patient's head, both rise, lifting the patient, and carry him off, stepping out right foot first. As previously noted, unnecessary movement of the trauma patient is to be avoided. However, if the unresponsive patient is breathing normally, but is in danger of choking due to mucus or vomitus, and/or you must leave him alone to summon help, place him in the modified Haynes recovery position. Here's how it's done. As a single rescuer, kneel at the patient's side and cross the far leg over the near leg at the ankles. Next, place the forearm across the chest. The near arm is positioned, pointed straight up. With one hand under the head to keep his neck straight, reach across with your other hand and grasp the patient's belt or waist and pull him toward you, placing him on his side with his head resting on his upraised arm. Next, both legs are drawn up, flexed at the hip and the knee. The aim of this position is to reduce rotation and flexion of the spine. This segment will deal with the care of wounds, both minor and severe. Any break in the skin, no matter how small, can allow germs to enter. Therefore, the first aid treatment for this type of minor injury is to thoroughly wash the wound with clean water. Apply triple antibiotic ointment to help prevent infection and cover the wound with a sterile dressing as soon as possible. When cleaning a wound, always work from the center of the wound outwards. Most minor cuts occur on or near the hands and can usually be covered by a small bandage. For difficult areas to cover, specialized bandage, such as the knuckle bandage or the fingertip bandage, may be applied. If these specialized bandages are not available, substitutions may be made by using individual components commonly found in most first aid kits. Here, for example, is another type of fingertip bandage. The wound has been thoroughly washed. A triple antibiotic ointment has been applied as a sterile compress and placed directly on the cut to be held in place with a gauze roller bandage. Place the bandage on a clean surface. Make 3 layers long enough to cover the injured finger. Then place the bandage over the finger and wrap it from bottom to tip with a closed spiral as illustrated. Then back down again. From there, the bandage is brought down across the back of the hand to the wrist, where it is wrapped and tied to keep it secure. By taking the bandage down the back of the hand instead of the palm, it is kept both cleaner and safer because it is less apt to get snagged on machinery. Remember not to tie the bandage too tight, so as not to interfere with circulation of blood to the hand. A nosebleed occurs when delicate blood vessels break, either spontaneously or as a result of a blow. When this happens, ask the individual to use her thumb and index finger to squeeze the nostrils completely shut so that there is no dripping of blood. Then ask her to lean forward and hold this position for 10 minutes while breathing through her mouth. Then, slowly relax the pressure on the nose and check for any continued bleeding. If the bleeding has not stopped, arrange for immediate transportation to a hospital emergency room or other medical facility. If the bleeding has stopped, suggest a follow-up visit to a doctor. Caution the person against blowing her nose. Some terms commonly used when discussing serious wounds are dressing and compress. These are materials placed next to or over wounds. Bandages are materials which hold dressings and compresses in place on the wound or which secure a splint to an injured limb. A bandage should be applied firmly and securely fastened. It should never be tight enough to cut off circulation. However, a bandage should not be loose enough to allow a dressing or a splint to slip. Practice is the only way to overcome these 2 common mistakes. In the event of a deep wound, it is usually best to leave the cleaning to a medical professional. A tetanus immunization may also be needed, especially with a puncture wound. Your immediate action should be to stop the bleeding. This is best accomplished by applying direct pressure to the wound. This quick-thinking first aider is using a plastic bag to prevent blood contact while applying the pressure. Practicing universal precautions, the second rescuer is wearing nitrile gloves. Do not remove the dressing if blood soaks through. Add additional layers so that the clotting process will not be disturbed. A pressure dressing can be used to maintain direct pressure on a wound. This can be accomplished with an elastic wrap. If one is not available, use a gauze roller bandage. Here's how it's done. Wrap the gauze around the wrist with the tail end sticking up. Then fold the tail down and wrap the bandage around once more to anchor it. Follow the contour of the arm towards the elbow, overlapping one half of the bandage. A spiral is used to wrap the bandage because the arm is tapered. A straight wraparound would be loose, allowing the bandage to slip. Add a roll of gauze or similar object directly over the wound. Cut the bandage down the middle. Tie an overhand knot to prevent tearing. Then tie the ends directly over the roll of gauze to exert a direct constant pressure on the wound. You are then free to attend to any other needs of this patient or others needing your help. Observe the demonstration of an open spiral bandage on a severe leg wound. The demonstration begins after the bleeding has been stopped and we're in the process of bandaging the leg. Fold the anchor in place and wrap the bandage around to secure the anchor. Now the open spiral technique is used to allow you to reach the upper part of the leg and properly tie off the bandage. The tie-off being demonstrated is called a loop tie-off. Make a loop and reverse the direction of the bandage, pulling it back under the leg. Make your first knot and cut off the roll. Then tie a second knot to secure the bandage. Take care not to tie it so tightly that it will shut off circulation in the leg. Be aware that the stoppage of severe bleeding does not happen immediately. Remember to remain calm, reassure the patient, and maintain direct pressure on the wound until the bleeding has been stopped. Then, relax pressure gradually. The applications of tourniquets on the severe battlefield injuries in Afghanistan and Iraq have provided considerable new data on the use of tourniquets to control bleeding. Fortunately, injuries of this severity are comparatively few in civilian life, and the need to apply a tourniquet is extremely rare. The first course of action is to apply direct pressure on the wound. On the very rare occasion that you are unable to stop severe bleeding with direct pressure, a tourniquet may be applied. A tourniquet should never be substituted for direct pressure, but should be considered rather than let the patient bleed to death. The one shown here is called a CAT tourniquet and is capable of completely stopping blood flow in an extremity. It has an adjustable circumference for use on either an arm or a leg. Here is how to apply the tourniquet. Place the band around the extremity above the wound and as close to it as possible without touching it. Tighten it by rotating the windlass until the bleeding has been stopped. Then lock it into place. Note the time the tourniquet was applied and loosen it every 15 minutes. Do not cover the tourniquet, but keep it visible at all times. Hypovolemic or traumatic shock is that life-threatening condition that exists when there is inadequate blood pressure and blood flow to supply the organs of the body. Shock usually occurs when there is a massive loss of blood from either injury or internal bleeding. The signs and symptoms of traumatic shock include a change in mental state, such as confusion. The nail beds will be pale. The skin may be pale or bluish and may also be cool and sweaty. The pulse may be weak and rapid, usually over 110 beats per minute. The person may complain of feeling dizzy or lightheaded. There may also be nausea or vomiting. If this occurs, turn the head or place the casualty in an appropriate recovery position so the vomitus will not be inhaled. Traumatic shock may be caused by any serious injury. Therefore, it is very important to treat all severely injured persons for shock, whether or not the symptoms appear. Observe the emergency first aid measures to combat shock.